Good morning, everyone. Today we are going to discuss lead poisoning, one of the very important topic from occupational diseases. Before starting, what is lead actually? Lead is a naturally occurring toxic material found in Earth's crust. Its widespread use has resulted in extensive environmental contamination, human exposure, and significant public health problems in many parts of the world. Why lead poisoning is a huge public health concern for India? Because of lack of screening systems. There are various factors because of which lead poisoning has become a serious health problem in Indian health system. So lack of screening systems is one. Second is inability to determine source of exposure of lead. Inability to determine what is the source of exposure of lead. And lack of implementation of safety norms. These three factors, they contribute in higher cases of lead poisoning. Lack of screening systems, inability to determine what is the source of exposure to lead, and lack of implementation of safety norms. So, more industrial workers are exposed to lead than to any other toxic metals. Now proceeding further, why lead is nowadays widely used in various industries? What are different qualities or different uses of lead? It has a low boiling point. It mixes with other metals easily to form alloys. Lead gets easily oxidized. It is anti-corrosive, used in many industries for manufacture of storage batteries, glass manufacture, shipbuilding, printing, potteries, rubber industries, and others. Workers in smelting and storage battery manufacturing plants, scrap workers, painters, workers in ceramic industry, foundry workers, welders, and petrol blenders are among those at greater risk of exposure. So these are very common areas or occupations in which lead poisoning may occur. Manufacturing of storage batteries, glass manufacture, ship building, printing, potteries, rubber industries, ceramic industries, and others. Most of the global lead consumption is for the manufacturing of lead acid batteries for motor vehicles. Also other products, for example, paints, stained glass, various glasswares, ceramic glazes, jewelry, some traditional cosmetics like sindoor, etc. People may get exposure to lead from many areas as I described. Now, what are different compounds of lead? There are some major toxic compounds and some less toxic compounds. Lead arsenate, lead oxide, lead carbonate, they are more toxic, whereas lead sulfide is least toxic. Lead oxide, lead carbonate, lead arsenate, they are more toxic, and lead sulfide is least toxic. Lead is one of the few metals which are abundantly present in environment. Lead exposure occurs, as I said earlier, through drinking water from lead pipes, by achieving lead points on windowsills or toys in case of children. Now, what is the actual mode of absorption of lead? Inhalation, ingestion, and skin. Inhalation is the most common route, by inhalation of fumes and dust of lead or its compounds. Ingestion, it is less common. Small quantities of lead trapped in the upper respiratory tract may be ingested. Lead may also be ingested in food or drinks through contaminated hands. So one was inhalation, second is ingestion, and third mode of entry of lead is skin. Inorganic compounds cannot be absorbed through skin. Absorption through skin occurs only in cases of organic compounds of lead, for example, tetraethyl lead. Clear? These are three modes of absorptions: inhalation, ingestion, and skin. Now, where this lead is stored in the body? Body store is about 150 to 400 milligrams blood level, above 25 microgram per 100 ml. It means the body store is about 150 to 400 milligrams and blood level is about 25 micrograms per 100 ml of blood. And increase to 70 microgram per 100 ml blood is said to be hazardous. Then we say a person is affected by lead and he has lead poisoning. Normal adults ingest about 0.2 to 0.3 milligrams of lead per day from food and beverages. This is the normal ingestion, 0.2 to 0.3 milligrams per day from food and beverages. Now, where is this lead distributed in body? About 90% of the ingested lead is excreted in fishes. Remember, whatever lead gets ingested, out of it 90% of the ingested lead is excreted in fishes. 10% of the lead is absorbed from gut, which enters the circulation. Remaining 10% it gets absorbed from the gut and gets entered into circulation. Out of this, 10% of lead enters the erythrocytes. It is then transported to liver, kidneys and finally transported to bones. Clinical features. There are two types of clinical features depending upon the lead poisoning, inorganic and organic. Actually, adults who have had mildly high lead level often recover without any problem. Exposure to lead can affect multiple body systems and is particularly harmful to young children and women of childbearing age. Adults who have very mild or high level often recover without mildly high lead level often recover without any problems. In children, even mild lead poisoning can have a permanent impact on attention and IQ. People with higher lead levels have a greater risk of long-lasting health problems. Actually, there is no any level of exposure to lead that is known to be without any harmful effects. Means if an adult has mildly high lead level, can sustain it, but if it occurs in children or women of childbearing age, it may prove harmful. What are the toxic effects of lead? Brain and nerve damage, decreased mental ability and learning difficulties, speech, language and behavior problems, hearing problems, anemia, high blood pressure, kidney damage, reduced growth, reproductive problems in adults, various digestive problems. Now these clinical features depend upon whether it is organic lead poisoning or inorganic lead poisoning. These are the symptoms of inorganic lead poisoning: abdominal colic, obstinate constipation, loss of appetite, blue lines on gums, stippling of red cells, wrist drop, foot drop, etc. Now these are the fingers seen in lead poisoning. Blue lines on gums, also called as Burton's line or Burtonian line. Symptoms of heavy metal poisoning. They include abdominal pain, dehydration, exhaustion or feeling weak, scratchy feeling in your throat, chills or a low body temperature, diarrhea, nausea or vomiting, numbness or prickly sensation in your hands and feet. Clear, these are the symptoms of inorganic lead poisoning: abdominal colic, obstinate constipation, loss of appetite, blue lines on gums, stippling of red cells, wrist drop, foot drop. In children, it may lead to damage to the brain and nervous system, slowed growth and development, learning and behavior problems, hearing and speech problems, etc., which in turn may lead to lower IQ, decreased ability to pay attention, and underperformance at school, which is the end result of this lead poisoning. Underperformance at school. Now, symptoms of organic lead poisoning: action on CNS, may lead to insomnia, headache, mental confusion, delirium, etc. Children who survive lead poisoning may be left with permanent intellectual disability and behavioral disorders. In particular, lead can affect children's brain development, resulting in reduced IQ. Now, how can we diagnose this lead poisoning? One is by history of lead exposure, clinical features as we have seen, inorganic and organic. Lab tests include coproporphyrin test, coproporphyrin in urine more than 150 micrograms per liter, aminolevulinic acid in urine more than 5 milligrams per liter, urine lead level over 0.8 milligrams per liter, and blood lead 70 micrograms per liter. What is the normal blood lead level? 25 micrograms per liter. If it reaches to 70 micrograms per liter or above 70, it is diagnostic of lead poisoning. All these confirm diagnosis of lead poisoning. Coproporphyrin more than 150 micrograms, aminolevulinic acid in urine more than 5 milligrams per liter, urine lead level 0.8 milligrams or more per liter, and blood lead level 70 micrograms per liter. Now, speaking about prevention of lead poisoning, important steps are substitution, isolation, local exhaust ventilation, personal protection. What do you mean by substitution? Where possible, lead compounds should be substituted by less toxic materials. In areas where there are dust, fumes of lead, where there is high concentration of lead, the occupation should include lead compounds that are less toxic. Isolation, all processes that give rise to harmful concentration of lead dust or fumes should be isolated and enclosed so that these dust or fumes, they should not come in contact with people, workers. Local exhaust ventilation, there should be adequate local exhaust ventilation system to remove dust and fumes properly. Personal protection, workers should be provided with appropriate respirators. Next is good housekeeping. Good housekeeping is essential where lead dust is present. Floors, benches, machines should be kept clean by wet sweeping. Work atmosphere. Lead concentration in the working atmosphere should be below 2 milligrams per 100 ml of 100 meters of air. Lead concentration in the working atmosphere should be kept below 2 milligrams per 100 meters of air. Now, periodic examination of workers. All workers must be given periodic medical examination, lab examination of urine and blood, also estimation of coproporphyrin test of urine should be done periodically. Periodic medical examination and lab examination of blood and urine, they remain cornerstones for diagnosis of and prevention of lead poisoning. Personal hygiene, hand washing before eating is an important measure. Prohibition on taking food in the working place is essential. Health education, workers should be educated on the risks involved and use of personal protection measures. Now combinedly, substitution, use of some less toxic lead material, isolation of all the processes which give rise to harmful dust and fumes so that they should not come in contact with the workers, local exhaust ventilation to remove the dust and fumes properly from the working area, use of personal protective measures which includes respirator, good housekeeping, and the important step in good housekeeping is wet sweeping of the floor, of the benches, furnitures, machines, etc. Working atmosphere, lead concentration recommended is below 2 milligrams per 100 meters of air. Periodic examination of the workers. All workers should be examined, replacement and periodical examination also. Lab examination of urine and blood. Personal hygiene, hand washing before eating, and prohibition on taking food in the working places is essential. Health education, we have to educate workers regarding what are the risks involved in the occupation and what are different personal protective measures which can provide him from getting lead poisoning. Now management. Manufacture, trade, import and export of household and decorative paints which with lead levels above 90 ppm is banned in India since November 2016. From November 2016, manufacture, trade, import and export of all household and decorative paints with lead level above the recommended value, that is above 90 ppm, is banned. And management, here the aim is prevention of further absorption and removal of lead from soft tissues and prevention of recurrence. A saline purge will remove unabsorbed lead from the gut. The use of D-penicillamine has been used with great effect as it is a chelating agent and works by promoting lead excretion in urine. We have to remove the lead from the gut so that minimum absorption occurs. So the use of D-penicillamine has been used with great effect as it is a chelating agent and it promotes lead excretion in urine. Now what is the International Lead Poisoning Prevention Week? It is celebrated from 22nd to 29th October. Thank you.